next slide is the member experience slide, and this basically captures in one graphic all the different things that we do for your members. I'll just go through it quickly from the top to the bottom. The top, basically, want to emphasize that we take a population health management perspective. So we're really trying to manage the health of the entire population. Obviously, there's a subset of the population, a small number of folks that are already chronically ill. We want to make sure they're getting all the care they need and having the best possible outcomes. There's also 25 to 40% of your population who are, and we already know it's about 35% probably given the health assessment results, that are at risk for developing a chronic illness in the near future. So we want to intervene with them very aggressively to help them live healthier lifestyles so they don't get one of those bad diagnoses. And then finally, there's about 50% of the population that don't have a diagnosis and aren't at high risk for developing one in the near future, but nevertheless will do better if they live healthy lifestyles. We know that even those folks can benefit from living a healthy lifestyle. So we try to offer something for everybody in the population. We have a lot of different ways of identifying people. We obviously use the claims data, we use our health assessment, and we use various kinds of referrals and triggers to identify people who could benefit from our services, and we reach out to them. We typically try to capture them. They're contacting us. We try to take advantage of that to engage them in the programs that we offer. We have a single platform for everybody. So one of the nice things about Health Partners is that all of our services are delivered on the same system. We don't have people sitting in, Phoenix and Pittsburgh and Philadelphia. They're all here in Minneapolis and St. Paul, and they're all working off the same software systems, and they all work together. So it's much less fragmented, much more seamless than many other carriers. And we also take a real focus on decision support. We think that one of the most important things we can do is to help our members become good health care decision makers. So we really want to offer them the services and the support to help them become like that. So we use shared decision making, which is a kind of a standard way to help people make medical decisions. And we have trained pretty much all of our frontline staff, the clinical staff, in the shared decision making technique. We offer shared decision making not just for treatment selection decisions, but also for provider selection decisions, lifestyle decisions, financial decisions, benefit decisions. So it's a consistent focus for us to make sure that patients are well informed about their options, that they understand about the risks and the benefits, and which of the risks and benefits of their different options matter most to them, and then make sure that they're able to make a decision. They can think through their options and think through whatever conflict and ambivalence they might have, so they're making a decision that's going to be the best for them. And then we have a wide variety of consumer tools on our website as well that people can use in making those decisions. Now we group our clinical programs into 5 categories. They're listed across the bottom here. The first category is the health and wellness program. So that includes our health assessment, our phone and web-based health and lifestyle improvement programs. We have a variety of discount programs or other kinds of incentive programs to encourage people to engage in healthy eating and physical activity. And so those are available through a wide variety of channels, and they're really designed for the benefit of all of our members. We also have a suite of worksite health programs where we basically offer various kinds of health promotion or health management services in the worksite. So that includes an EAP service. It includes health promotion and educational services like seminars and brown bag lunches, those kinds of things. It includes web-based employer health improvement tools that we can have you give to you, and you can actually implement using your communication systems, customize it to your look and feel, and use that to help your employees become better educated about how to take better care of themselves and live healthy lives. We have a flu shot program. We do work comp certified managed care. And we also have a program called Well at Work, where we can actually put a clinic in the work site, provide care to your employees and dependents in or near the work site. So another thing that's actually very unusual about Health Partners is we have actual disease prevention programs. So again, because we can identify people as being at risk of developing a chronic illness in the near future, that gives us the opportunity to intervene and actually prevent the development of chronic illness. We're not just managing chronic illness, we're preventing it. And then we, of course, have our disease management programs for the folks that already have chronic disease, and for those who have complicated comorbidities and you're dealing with relatively intense health problems, we have a very sophisticated case management program that is probably one of the best in the country. Bottom line is that all these services are available for every member of ours across the country. It's the same member experience whether you live in Pawtucket or Timbuktu.
Okay, I'm